things I shouldn't do in this instance, such as she just had a car accident a week ago. Does that seem very safe?
No.
Okay, particularly if there are any strains, muscle tears, sprains, which are impossible to know, or her nerves are just still shot from the experience. Okay? Acute visit, might I even be able to go in there and do stuff?
Mm-hmm.
What might be an approach to take? So there's acute versus chronic cases, right? Acute, let's say she's been to her doctor, cool, said go ahead and work with her. If I'm working with her, and I notice pretend like you're uncomfortable. Okay, she's doing that. What is that? What is her body telling? What is she communicating?
She's protecting.
Does she feel safe?
No.
No, she doesn't. How much am I going to get accomplished if she does not feel safe? No. Okay, so if she's doing this, that's saying, not ready, which is cool. Are there other ways I can help her neck feel better without interacting with her neck? How?
Work around it. Shoulders.
Such as, okay,
Shoulders. Okay.
what else? Think even more distal.
So,
I think you could
do some reflexology on the feet.
Yeah. What's so lovely thing about this nervous system approach is relaxation is relaxation. When the nervous system is relaxed, guess what? It's relaxed. Okay? And this is where kind of like, woo, what do we, it's more about the quality of touch than where you're poking it. Does that make sense? Okay? So if she's in a hyper-vigilant acute state, can I get her to trust me by making something else feel really good?
Mm-hmm.
Right? Chances are, is she going to be doing this? I mean, maybe if I start doing stuff like that, I don't want to do that, right? But if I'm working distally or telling her, hey, we're going to let that heal. There's a healing process going on. If she's got muscle tears and all of a sudden I'm doing this stuff to her, could I be causing help or harm? Okay. There's a chance of harm, I'm not going to do it. Then some people are like, oh, be more resilient, whatever. Okay. I don't do that in here. All right? Now let's say she's progressed a bit more. A couple weeks have gone by. Things have settled down a bit. What is the next thing I need to be cautious of? So she's settled down. What don't I want to do?
Get her back uncomfortable.
Oh, yeah. Do I want to trigger any motions that are going to have her go like this again? No, because this is still in a vigilant edible. This is still cautious and protecting your body. There's people that have automobile accidents, and then for years after, they don't want anybody touching their neck or anything like that, right? We're self-protective mechanisms. That's why that's there. So with that, what is it my goal to do? Right? If she's in an acute state and I'm rubbing on this, is that going to make a tear magically disappear?
Mm-hmm.
No. That's a healing process that needs to go down with or without. Right? So what is the goal of this session?
Get her as relaxed as possible.
Get her as relaxed as possible. Get it so that her body can resume normal activities without hypervigilance getting in their way after the tissues have healed. Does this make sense? Right? So let's say I can go in there. We've established a therapeutic relationship. She trusts me now because she knows this woman's not going to treat my head like a toy or like a piece of me. She's aware of what I might have been through, and this feels safe. Cool. Right? So that's when I can go in and do a bit more direct work. Make sense? Now, this whole SCM grab. If you want to do it, cool. I'm sure you'll do it well. I don't. I don't teach it. I used to do it. I don't do it. I think it's really aggressive. not for me. So everybody that's on the table, I treat them like a baby. This is an infant's head, and treat it with that kind of care. If I approach it with that care, I'm not going to be. When you're picking up a baby, how do you pick their head up? Are you just like, hey kid? No, you're a bit more gentle. So, you know, all of us have like a little inside baby that that's still there. So speak to that part of it. Yeah, so speak to that part of them. You're not in it. I'm sorry. Okay. So SCM right here. A safe way to do that is I just kind of lay my hand there. All right. Anteriorly again, and also what we, before I go into what we need to be aware is history of trauma on people. I'm speaking strangulation and things like that. This may sound extreme to you, but this happens. This is real world stuff, all right? 1 in 3 women has experienced physical, sexual violence in their life, domestic violence, things like that. For men, it's like 1 in 5. Right? And men don't talk about it as much, like it's good, you know. And we need to be conscious of that, not to do things like this, right? That's real talk. That can be very triggering for people, right? So, I give people choices, right? Give people choices. Does this feel okay, or do you rather I work back here? I don't have to work here. Right? Don't say, oh, does this feel okay? Because they're going to say, yeah. You have to give them another option. They don't want to hurt your feelings, right? And you're like, yeah, of course that feels okay. Or do you rather I work here? I don't have to work on it directly for it to feel better. That's the truth. Thank you. I could work on her feet, and this could feel better, relaxing the nervous system. So I'd say we've cleared all that out of the way, good to go. If we have a red light and you do feel, and they say, hey, work in this area might be beneficial, really easy way to do it. And if you see SCM kind of pops up right there, right? Right there. Some people's will pop up more than others, not a problem. You can feel for the attachment here and just stay a little posterior to it so it doesn't have that choky feeling. And all I'm going to do is I'm going to slowly turn her head into my hand this way. And I'm just outlining it. It does not need any more than that. All right, you can add. And I know this, if people are like, oh, I wanted to see cool stuff where you flip the head around. In case of whiplash injury, cool stuff's not going to do it. All right. So stuff like this. All right. Also working just the attachment area. All right. And it doesn't take a lot of pressure. All right. And here I am, as you can see, I'm just right posterior to her SCM. If there's tears there, I don't want to there's no need to strip the SCM directly. There's not anything extremely wrong with it, but it's not entirely a safe feeling either. All right? You can work the proximal attachment point there. That can take a little bit more pressure, a bit safer, right? You're not by that sympathetic ganglion here. All right, the other side there. So here, and if you can take a bit more with, I don't want to, sorry, bad choice of words, not take a bit more, but if she seems to allowing a bit more, then you can go ahead and continue with range of motion, right? And right back here, I'm also, if you look under here, I have fingers there, so it's not, I'm just kind of giving it a little hug back here. Is that okay? Mm-hmm. All right, and move slow. This is not an area where you don't jostle the head. You're not like, legs fine, arms cool, hips. All right, the head doesn't lend well to that. Or people like doing, the really fast movements. No need. Like one really slow one is as impactful, if not more, than very fast motions. Okay, and the same thing on this other side. Cool. All right. Traction, nice, as long as somebody, and again, remember, I'm not pulling with my arms. You can't see it well, but I'm going to exaggerate my body. I'm just, your hands are bothering you or whatever, you can also do this. This is just arm here, that. And do some other range of motion stuff. Again, just this. And I have another hand here. Easy. Feel safe. And then the other side so she doesn't get jealous. Here. I feel like I can get a little bit more, so I'm just going to slowly reposition her. There. Get a little bit more of a lift. Easy. If I want to, it seems like she might want the back of her neck stretch. There. Again, baby's head. And sometimes I'll do, whether you're comfortable or not, I have I'm using my belly. Right? Not everybody might feel, but you've got to gauge where you're at. And while I'm here, this hand can add as an extra support. See? Just kind of rested on my hip there. Because now I have a lot of points of contact. Nora, does this feel safer or does that feel safer? It's just more points of contact, covering as much ground as possible, right? Sometimes you got a dude, you know those dudes with the real heavy heads, right? Another thing that can be done, and if this is uncomfortable, let me know, right? I'll do this, and sometimes I'll just put this here. I might have something in my pocket, I apologize.
Try your knee.
Yeah. Okay. Oh, no, it's easy. Or a pillow works just as well. But if, you know, these are all things that are okay, granted, if somebody is okay, right? If somebody's okay with it. And I'm just have her the whole time. I'm not going to go and then drop her head. This is can be a kind of a scary feeling for somebody, believe it or not. I'm going to support it the whole way down. Okay, the baby's head, right? So that's a lot of the stuff for whiplash, the myofascial stuff. We could do that too. Again, here, just kind of, I'm going to go on this side of the body. This annoys my wrist. I'm not about that life, right? I'm going to go on this side of the body. And again, be mindful. Don't be like gazing at them. Like, that can be kind of creepy, right? But here, I'm just going to go here and give it like a hug this way. Super easy. I'm relaxed. Got the chair. I'll show on that side too. Okay? I'm not using a lot of pressure. Right? And this is that skin draggy feeling. Very, very safe.
Are you pulling or pushing?
I'm just kind of letting it drag down and giving it a little hug.
Okay.
I'm hugging. All right, again on this side. Okay, and again, don't be like, right, posterior to the SEM. Take your time, get your hands comfortable. It's gonna feel good even while you're, that's it. And I'm just gonna hang out here for a second. Is that okay in the front of your throat? Mm-hmm. That's not for show. That's how I check in with people. Right? Because for some people that might feel snaggy here, they might not like it. They say it is. I'm like, ooh, I'll adjust. Okay. All right. So that is whiplash. You're welcome to